The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody, and welcome to Reproaction's June webinar. Immigrant justice is still reproductive justice. I am going to go ahead and get us started. So I am Jessica Ensley. I will be your co-host for today. I use she, her pronouns. I'm the Senior Vice President of Outreach here at Reproaction, and I am based in Washington, D.C., and I will pass it over to my co-host, Jacqueline.
Hi, everyone. My name is Jacqueline Hernandez. I use she, ella pronouns, and I am the Senior Outreach Coordinator for Reproaction, and I am based in the Rio Grande Valley.
Great. So here is an overview of our agenda. I will introduce our organization, then we will get into a topic overview and introduction before we head on to our wonderful panel discussion. Then we'll get into next steps and Q&A. So if you have questions for our panelists at any point during this webinar, please feel free to enter that into the question section of the GoToWebinar. And you can join our conversation live on Blue Sky following the hashtag Reproaction or our Reproaction Blue Sky account. So Reproaction leads bold action to increase access to abortion and advance reproductive justice. We are known for our left flank analysis, our willingness to hold folks on all sides accountable, whether they be allies or opposition, and our commitment to nonviolent direct action. And with that, I will pass it over to my co-host Jacqueline to talk about today's topic.
So we want to start off with the history of immigration and reproductive coercion. The first federal law of quote unquote illegal immigrants was the Chinese Exclusion Act of 1882, and it excluded anyone who wasn't a student, a merchant, or a diplomat. This act also created the Federal Bureau of Immigration. The US had open borders up until 1924, and that was when Border Patrol was created. In 1911, the first border fence was built, and the Secure Fence Act of 2006 under the Clinton administration started the construction of the border wall. The Mexican repatriation, it happened during the 1930s, which was the Great Depression, and the US forcibly deported over 1 million people of Mexican descent, including US citizens. There was no due process or legal hearings for these people, and it actually criminalized cultural identity. Cities like Los Angeles, Chicago, and New York were targeted specifically. To continue the history of immigration, we have the Bracero program, which was during the 1940s through the 1960s during World War II, and it allowed Mexicanos, people to work under exploitative conditions. And this included wage theft, poor housing, lack of labor protections. And my great-grandfather was actually part of this program, and we have heard stories about the discrimination that he did face during this program. Also, Operation Wetback, which is a racist slur. It happened during 1954 during the Eisenhower administration. It is known as the largest deportation of people, and as many as 1.3 million people were deported during this operation. We have the California Eugenics Law, the Asexualization Act, which happened between 1909 through 1979. Over 20,000 people were sterilized without their consent. It targeted people who were quote unquote unfit to parent. They were perceived unfit, and that was based on language, poverty, and race. And it mainly impacted women of color. We have the case of Nancy Hernandez in 1966. She was a 21-year-old Mexican-American mother and refused sterilization and was actually jailed for 3 months. This drew attention to state control over brown women's bodies. We also have another case in the 1970s of Dolores Madrigal, who was forcibly sterilized without her consent. There were also many other women who went through the same experience and are known as the Madrigal 10. The women sued to end the practice of sterilization in California, but they actually lost the lawsuit. And then recently in 2020, at the Irwin County ICE Detention Center, there were forced hysterectomies on people. Our enforcement and family separation slide, we're going to talk about systemic criminalization of immigrant communities. And 56% of Latinos have had encounters within the criminal justice system. Immigration violations are usually prosecuted as criminal offenses. I did want to note here that ICE was created after 9/11. Presidential directive, recently Trump has ordered ICE to step up deportation efforts with a goal of 3,000 arrests per day. ICE has focused on restaurants, agricultural fields, courthouse hearings, frequently at food stands, pulgas, and other small markets. ICE agents are also cited in plain clothing with no badges. For-profit detention centers. Immigrants are usually held in detention centers run by private companies like Geo Group or Core Civic. And people have said that they have experienced medical neglect, poor sanitation, and psychological trauma. Pregnant women in other detention centers have reported miscarriages, lack of prenatal care, and threats of deportation during active labor. With this in mind, ICE arrested Iris Diana Monterroso Limes, who lost her pregnancy due to neglect of medical care at the Richwood Correctional Center in Louisiana this past spring. We have the Ursula Processing Center, which opened in 2014. It's the largest center in Texas, and it costs taxpayers about $30 million in renovations since 2020. In family separation between 2017 through 2021, more than 4,600 children have been separated from their families. Over 1,360 children are still missing and have not been reunited within their families. The system uses welfare checks. Migrant children are being visited by ICE, and some of them are actually being taken to the Office of Refugee Resettlement, and there is currently about 2,500 children there that are separated with their families, without their families. So our current administration right now is creating a larger class of undocumented people by de-legalizing them and taking their work authorization early. People are being deported without no due process. Guantanamo Bay just opened up. They have about 500 migrants at the facility currently, and it's costing $100,000 per day per each person. The Supreme Court on May 30th actually approved ending temporary legal protections for over 500,000 migrants from Cuba, Haiti, Nicaragua, and Venezuela. On June 23rd, the Supreme Court also lifted limits on Trump deporting undocumented folks to countries not of their origin, like South Sudan, which they have no ties to. All this to say that community resistance is still strong, and some ways we can all resist to state violence is through mutual aid, and that includes holding space and care for our neighbors and people, offering rides, grocery shopping, checking in with friends, family, and neighbors. It's also very important to also safety plan and having emergency contacts, a family plan, medical care plan, and plans for your pets. It's also important to have important documents safely, like IDs and birth certificates. We have included the National Immigration Legal Services Directory, where there is great information. Immigration legal services may vary by state. And it's also important to plug into local organizations, whether that's through volunteering, donating, or amplifying the message, and remembering that knowledge is power. And I want to go ahead and introduce our very first guest panelist, Ana Obregón. She is the National Program Supervisor for Alianza Nacional de Campesinas, Incorporated. Ana Obregón is a third-generation migrant farm worker and survivor of childhood sexual and domestic violence, whose lived experience fuels her mission to end gender-based abuse. For more than 20 years, she has advanced the violence against women movement, holding every frontline and executive role within a certified sexual assault crisis center, including a 24/7 crisis line response, care coordination, survivor-led support groups, community education, and ultimately program director. Throughout her tenure, Obregón has championed trauma-informed, culturally responsive services for immigrant farm worker families, where systemic barriers often intensify the impact of violence on women. She advocates holistic healing and approaches that promote dignity and pairs alternative cultural context wellness practices with long-term economic empowerment and policy reform, ensuring survivors receive flexible, practical resources to rebuild safe and thriving lives. Obregón's blend of personal resilience and professional expertise has earned her recognition as a strategic leader and trusted voice in efforts to create culturally specific, protective, inclusive support systems that mobilize campesinas to end gender-based violence. Ana, thank you so much for joining us today.
Thank you for having me.
And I wanted to start off with the first question of why it's important to address gender-based violence faced in the agricultural sector by our campesinas. And to our listeners and audience, campesinas is, the translation is the female like farm worker in the agricultural sector.
Well, Jackie, it's very important to address it because it is crucial. And just to give a little background, sexual violence, such as sexual harassment and assault, is very prevalent in the agricultural work. There's a lot of it happening in the fields, and it's due to isolation, power imbalances, fear of retaliation, and of course, deportation. So many times campesinas, farm worker women, often endure different types of bullying, sexual harassment, and assault. And this is done in silence. It's not very much addressed. We don't have a lot of statistics because, first of all, talking about sex in our communities still continues to be a taboo. So making sure that we understand that this is not just a matter of violence, it's a matter of human rights, and workplace justice is something that helps us understand that we have rights, we have the right to our own power, and to make sure that we are sharing information that is going to help campesinas themselves decide to take whatever justice they feel is needed for themselves.
And that's a very important reminder. I feel like sometimes my grandmother worked in the fields, and I don't think I ever asked her, or she didn't ever talk about her experience through that. So I think it's a very important topic to address the gender-based violence that they do face.
It is. One other thing, Jackie, what we know of the work that we've been doing in communities, it seems like 8 out of 10 women have had some sort of experience of sexual harassment and or assault. And sometimes this even happens when our own family members are in the same field, our husbands. So it is very important to address it.
Thank you. That's an alarming statistic, and it just goes to show that we definitely need more, we need a spotlight, right? The violence and the experience of campesinas, and that their voice is powerful, that their experience does matter. And with that, what does the impact of gender-based violence and labor have on the mental and physical health of the campesinas that you've seen?
Well, that is a very loaded question. And just imagine the intersection of gender based violence, their migrant status, everything that a person has to go through to leave their own country to come to a new country to try to make a better life for themselves and their families. We already come with some sort of trauma. We come carrying different things that happened to us throughout our childhoods. So coming into an area where violence continues to happen and many times rapidly, uh, it's a very high impact on our lives because we carry that trauma, especially if it's unresolved. It can turn into toxic stress that ultimately impacts our overall well being, including our physical health. It can lead to things such as, diabetes, high blood pressure. We have, we tend to go and seek medical attention when we're hurting. Number one, campesinas are here in the United States because of what I said. They came to look for a better life. They didn't come to do anything else but that. So many times their health is put on the back burner. So we don't address things that are coming up. For example, aches that are, red signals that something is happening to us. We tend to ignore it if it's something that we can handle. And that's the attitude that we have. If it's something that I can work through, then I'm going to do it. I don't think about the prevention of my health. What I do is I react when something is already happening to me. And it's usually in a stage where the effect is going to be, something that has to be treatable.
Yeah, I think that's a good thing. Well, right now that we're talking about it, because even within my own family, I feel, including myself sometimes, and I feel like a lot of Mexicanas, a lot of Hispanic, Latina women, and especially like our campesinas, we have this mentality of like endure, right? Like la familia primero, like family, put family first, right? And then yourself. So that's a great point that you bring up. My next question of this is, with campesinas working in the fields, how does exposure to pesticides affect their ability to sustain healthy pregnancies or raise children in safe environments?
Well, I have to mention, Jackie, that pesticide exposure has devastating effects on the reproductive health of, anybody who comes across these toxic they're airborne elements that, we're breathing. Many pesticides used in agricultural fields are linked to miscarriages, birth defects, infertility, and developmental disorders in children. And many times our farm worker women don't even know that these things that they're seeing in themselves and their families is a result of the work that they are doing, because many times they're not told about the toxicities in these pesticides, so they continue to work. Sometimes it's not just even the work. uh, when they have their breaks, they sit in between, the farm fields, and they're eating breakfast, their lunch. Many of them also live at a very close proximity to the fields. So this isn't something that they're taking in brief moments or throughout a certain period of time. Many of them are breathing in these toxins all day long. And so, of course, it's going to endanger their pregnancies and, and, and their children. And sometimes those ailments are not seen until the person is an adult. So they don't really relate it to pesticides. And that's where we come in and make sure that we are providing information that can help the campesinas, campesinos, um, make decisions about how they can protect themselves. And this includes even talking to their employers about using other types of pesticides that do not have so many toxins in them.
Thank you so much, Anna, for that. Go ahead. Go ahead.
I wanted to mention, Jackie, we've seen how devastating this is. You can see where, farm workers even have rashes that are unexplainable on their hands. We wear gloves, so imagine wearing gloves, having a rash, and then put on top of that the heat. So we're working in pain constantly. It's, something that really needs to be addressed.
And thank you for bringing that to our attention. And I think it's very impactful work and very important work, especially for the people that are working every day there, on top of other worrying things that they might have, having to worry about sustaining a healthy pregnancy, or even their health. Regarding their work, it's very important. I appreciate all of your knowledge and all of your expertise. So thank you so much.
Thank you, Jackie.
Thank you both, Anna and Jackie. I will go ahead and introduce our next and final panelist. If you have questions for either of them, please feel free to enter them in the question portion. So I would like to welcome Kathy Torres, Organizing Manager with the Frontera Fund. So Kathy, using she, her aya pronouns, 29, has a Bachelor of Arts in Sociology with a minor in Biology from the University of Texas, Rio Grande Valley. Kathy is an Advocates for Youth alumnus who participated in Young Women of Color for Reproductive Justice for a span of 4 years. She now serves as a member of Advocates for Youth's Board of Directors. She has 11 years experience in community organizing with a focus on social and reproductive justice. Kathy has been a volunteer with the Frontera Fund, the Rio Grande Valley Soul Abortion Fund, since 2016, and joined the Frontera Fund Board of Directors in 2019, where she worked as the lead helpline volunteer and event planner. She has since come on as full-time staff with Frontera Fund as the organizing manager since 2021. Kathy has had extensive experience working in coalition with several social justice groups in the RGV area to achieve reproductive justice along the Texas-Mexico border. Additionally, Kathy previously worked as a youth medical case manager for 2.5 years at the Valley AIDS Council, aiding youth living with HIV in her community. Kathy, thank you so much for joining us today.
Hey, y'all. Thank you so much for having me. I'm really excited to have this discussion. I think it's really important.
Absolutely. My first question for you is, What barriers might people face when accessing reproductive health care and abortion care in the Rio Grande Valley due to their immigration status?
Yeah, that's a great question. I mean, I think one of the most unique parts of the valley is where we are geographically. We are on the very southernmost tip of Texas, at the very, very bottom of the state. And because of our location, we are met with a lot of layers of policing and hypermilitarization, both statewide and federally. So one of the projects of the federal government of Department of Homeland Security would be our internal Customs Border Patrol checkpoints. So I can describe them briefly. They are located within 100 miles north of the port of entry. There are 4 checkpoints in the valley or within the like leaving the valley, and there are 20 across the border in Texas. So they look exactly like ports of entry, and they are run by Customs Border Patrol. So as you are traveling north, anywhere out of the valley, anywhere in other border cities, you are met at this checkpoint. And at the checkpoint, agents will ask you if you're a U.S. citizen. So you answer the question, but it's at their discretion whether they believe you or not, frankly. So they can detain you and search you, and so be it. I have been searched multiple times. I actually thought this was normal. Like I didn't know that this was abnormal until I was in college, because it was just a part of traveling out of the valley. So you can imagine how a gigantic, like federal and state-backed internal checkpoint can cause a lot of fear and anxiety, and especially in a state like Texas where people are forced to travel for their abortion care. So if someone is undocumented and they are traveling north, and they meet the checkpoint, they are, forced into parenthood or risk deportation. And that is the reality for someone with a differing citizenship status traveling out of the valley. In addition to these concrete things, there are also fear mongering policies in general. The state consistently perpetuates a cycle of fear that prevents people from not only traveling out to receive abortion care in a clinical setting, but even accessing healthcare and reproductive healthcare in the valley. Like several clinics have reported that they're seeing a drop in attendance. Generally speaking, in the valley, it's very common for folks to live within mixed status families. So this trickles down and perpetuates a cycle of fear and poverty amongst mixed status families. And an important element to living in the valley is how frustrated we often are because we are disenfranchised from the state. 1 in 3 people in the Rio Grande Valley are living without health insurance, and that is perpetuated by so many um, racist policies that the state of Texas passes, that the federal government continues to place limitations on, and this then allows for policing to run rampant in our community. And because of these policies, because of how heavily policed our area is, most folks think, well, if I can't travel out of the state to access abortion care or to get pills, then I can just go to Mexico. And while that is common for a lot of people, that is not possible for people who aren't documented. If who aren't documented go into Mexico, they cannot come back. There's so many different layers, and I'm sure I can go on and on, right? But barriers that do impact people receiving reproductive health care and abortion care because of their immigration status.
Thank you so much for sharing that and walking us through to what those checkpoints are. As someone who grew up in the Midwest, yeah, very unfamiliar with that as a thing until I started learning more in college as well. So thank you for walking us through what that looks like, since not everybody lives in that area. My next question, you touched on this a bit in the your first answer, so I just want to go a little bit deeper and ask, how do anti-abortion laws endanger specifically immigrant parents and their ability to care for their existing family?
Yeah, I mean, inherently, abortion bans are racist, right? And to expand on that, they primarily impact people of color, undocumented people, and people who are trying to make ends meet. These are communities that are predominantly targeted by abortion bans, and politicians know that. For example, like the internal checkpoint is a huge like concrete barrier that I expanded on earlier, but politicians, and I can speak from Texas at least, since that's where I live and that's where we navigate these laws, but state like Texas politicians are very aware of these checkpoints, and they know that travel bans will impact immigrants who are already so barred from freely moving in the world. We all should have the autonomy to freely move on our land, right? So um, that's a lot of the reason why policy makers will add components that will make traveling really difficult or will force people to travel. They're very aware of the communities that will be impacted by this. An example, a historical example could be um, the passing of Rosie Jimenez. You know, Henry Hyde, I'm sure a lot of folks are familiar with the Hyde Amendment, but what the Hyde Amendment did was ban federal funds from covering abortion care, i.e. Medicaid. And so Rosie Jimenez, who was relying on her Medicaid to get her abortion, unfortunately passed away because the ban went into effect that banned federal funds. And she was from McAllen, Texas. Well, Henry Hyde stated and openly stated, if I cannot make abortion illegal, this was in the 70s, by the way, if I cannot make abortion illegal, then I will make it impossible for poor people to access abortion care. So this is the same mindset that anti-abortion politicians utilize to further make abortion impossible for people. And this also creates a cycle of criminalization. So, for example, anti-abortion laws like 2021 in Texas, like 2021's SB 8, created a culture of policing and community policing, where people, and it's still in effect, by the way. Things just got worse, but this was one of the first, at the time, the harshest abortion ban in the country. But that created a vigilante system where anybody could go and sue anyone who they felt was aiding and abetting an abortion, and then there was like a $10,000 fine slapped onto that. Still in effect, I will reiterate. However, even though that does not have a criminal statute applied to it, we did have a moment where a Valley community member was thrown in jail because of a pregnancy outcome in 2022. So all of these laws are racist and they perpetuate a cycle of criminalization. So you can imagine how that transcends into how it affects immigrant families, right? So anti-immigrant policies are also anti-abortion policies. They are a major impact on our reproductive autonomy, right? There are policies like it's one of the versions and iterations of SB 4 in Texas, and what that did was it created a policy that stated if anybody is stopped by any policing, police of any sort, DPS, the local police, customs, ICE, and they have a person who is undocumented in their car, they can face up to 10 years minimum jail time under the guise of quote unquote trafficking. So that could even, like, it's so common in our community. Our neighbors have different citizenship statuses, family members, people in our household. So God forbid someone needs to go to the doctor and you give them a ride, right? And so God forbid someone needs to go to their IUD appointment, right? So this is a connection between the two. And recently, during this past Texas legislature, we had another iteration of SB 8. SB 8 is just a cursed collection of numbers and letters. But this recent passage of SB 8 requires counties with populations of over 100,000 to have contracts, 287G contracts, meaning that ICE will be required to go to these counties and do the work that they are being told to do. So this was recently passed, literally signed by the governor earlier this week to go into law. And you can imagine how we're already facing swaths of ICE agents coming in and destroying and devastating our communities. And now not only will it be the federal government's doing, but now it'll be backed by the state. So all of these layers of policing are also inherently anti-abortion laws because they create um, a culture of fear that prevents people from accessing the care that they need and want. And it will affect parents and families. You can imagine how this could create fear for raising a family or choosing to parent or not parent.
Absolutely. Wow. Thank you so much for walking us through the myriad of different ways that abortion and healthcare as a whole is inaccessible to a lot of folks in Texas. My final question for you right now, before we head on to next steps in the Q&A, is what ways can the community support better access for immigrants and undocumented folks seeking reproductive health care and abortion?
Yeah, I mean, and this is one of my favorite things to talk about, this question right here, because we already hear so much of what's going on. We firsthand experience the different ways that we are being attacked as a community. But there are also ways to push back against these things, to uplift your communities and hold each other close. And so ways that I can recommend would be continuing to talk about abortion to your communities, whoever they are, whether that be the friends that you hang out with on the weekend, someone you're grabbing coffee with, the dinner table. That is really, really, really important. If you have a following on social media, if you're interested in volunteering, and say you're volunteering for like a random organization that has nothing to do with social justice, maybe y'all like play chess on the weekend, talk about abortion there. I think it's important in doing that, you do become a resource for your gente, for your community. People will start to ask you questions, and maybe someone and it could happen, and it probably has, someone needs an abortion, or someone they know needs an abortion, they can go to you to be that resource. Be bold about self-managed abortion. Abortion is excuse me. Yes, there are so many restrictions on abortion, but people have had, will have, and will continue to have abortions. So be bold about self-managed abortion, protocol, and how one can do so, how to access pills, because that is one of the only options for a lot of people, and also people's preference. So be bold about that. Arm yourself with knowledge about the state of abortion in your local state, how to do a self-managed abortion, where to access pills, and connect with local resources. In the Valley, there's so many local resources like the Frontera Fund, South Texans Reproductive Justice, Abortion on Your Own Terms, Reproaction, shout out Jackie, and the National Latina Institute for Reproductive Justice, and so on. There's even so many youth-led initiatives here in the Valley, and I can imagine in other states. Connect with those folks. And also make sure your conversations are multilingual if they can. Language justice is really important, and that can be a barrier in and of itself. So these are all different ways that people can connect to the work. I'm sure a lot of folks already do this, being that this is such a nuanced topic, and I see the list of attendees, very excited that everyone could be here. But if you are already interested, you're already doing so much. So I hope that y'all take away from this conversation, and we can make our world more just and equitable, and ensure that we can achieve reproductive justice in our communities.
Awesome. Thank you so much, Kathy, for sharing all those resources. And yes, absolutely, folks should arm themselves with information on self-managed abortion with pills too. Reproaction has a campaign regarding that. You can find out about the World Health Organization protocols for self-managed abortion with pills at reproaction.org/SMA. And sorry if you hear any background noise, my dog is wrestling around. So with that, we will head into a couple of housekeeping items. You can plug into Reproaction campaigns at reproaction.org. Follow us on social media at the handle Reproaction everywhere. And then stay tuned for our next month's webinar by signing up for our email list at reproaction.org. So if you have questions, again, please feel free to enter them in. My first question is for Anna. I wanted to ask, what are some common misconceptions that folks who maybe aren't as plugged in have on Campesinas and the issues that they face and what resources they may need?
In regards to reproductive justice, well, we know one of the things that they lack is health insurance. Unfortunately, the state of California is the only state that has labor rights for campesinos, for farm workers. All other states do not provide uh, any type of legal labor rights. So that's something that a lot of people don't take into consideration. A lot of people believe that maybe campesinas, when they are coming, and presenting different health issues, that it could be a lack of their personal care, and it's not due to that. It has to do with the unsanitary conditions that they are offered many times when they have to go to work in the fields, and even when they're working in packing houses. There's just such a lack of unsanitary conditions that contribute to their healthcare situations.
Got it. Thank you for walking us through that. My next question is for both you and Kathy, whoever wants to take it first. And what, if anything, has changed within the past 6 months with this new administration and the work that you all do? And what can we do to fight back against that?
I can jump on first. I think for us, yes, things have gotten, things are bad, right? I'm sure we can all agree on that, and we've seen a lot of the devastation that this administration has caused with just the past 6 months. But I do want to mention that things have always been inaccessible and difficult, especially in areas like the Valley, um, and that's on purpose. So one thing that I can mention pretty much since the fall of Roe, and it's been a consistent issue, and has been that people are voicing their fear to us on our helpline. People are scared to travel out for care because they come from mixed status families, or they're scared of getting in trouble. People are calling as soon as they're pregnant, because information is so limited, and not limited, there's plenty of information out there, but people are even scared to look up information. And so this level of fear and anxiety is also perpetuated by living in a surveillance state, right? What we experience here on the border, and the layers of policing and surveillance that is involved, is are the same tactics that are being used in the genocide on Palestine, right? So it is all similar, and it all is layered, and the mirroring is really like terrifying. So all of this to say, yes, the last 6 months have been difficult. And it's so I wish that this could get wrapped up, right? But the reality is, in areas like the Rio Grande Valley, this has been our reality. There is still there's this obvious, like a very obvious shift in people voicing their fear, but the fear has always been there. And that's why Frontera Fund is here, and folks like y'all at Reproaction are here to help let people know that there are resources and they can access the care that they need. And I think that we should just continue to always push back, take deep breaths and push back and hold our community close.
As Kathy mentioned, these situations have already existed among the farm worker communities. What has happened in the last couple of months is that it has compounded and exacerbated the situations for campesinas, campesinos. Uh, it's just made that the level of fear even greater, which then impacts the other things that farm workers are going through. And it's really important to understand that right now everybody knows what's happening in our country, and we have to find ways to not contribute to that additional stress, but find ways to provide spaces for people to be able to talk about what's happening to them, what are they feeling, what are they going through. This is what Alianza is doing. Alianza works with a membership of 20 organizations, and we go out into the community, we go into the fields, we do community educational meetings. And what we're finding, it's getting more and more difficult to gather the women together to talk about these very important know your rights trainings and everything that they have available to them. So the isolation is even at a greater risk, because what we know from isolation, it does provide that vulnerability and that space for continued violence against our farm worker women. So Alianza Nacional de Campesinas is here to provide the information that we cover through our 4 priorities. We do this through social media. We have monthly work groups that talk about these different issues. And this is where women are coming and having that safe space to be able to present what's happening in their own state, because we do work in 20 different states. So it's really important to understand that the laws are different. Even though we see that they're not being respected at the moment, there is something that we can hold on to. And it's really, really important that we don't focus on the moment, but try to see beyond what's happening right now. Because when we do get out of this situation, we're going to come out of this very strong as a community.
Absolutely. Thank you both so much for walking us through what the past few months have been and tying it back to this has been going on in your communities for a very long time. There definitely is a lot of fear mongering intentionally from this administration, with like we've seen with sending folks to Guantanamo Bay. It has no benefit. It costs a ton of money that doesn't make any logistical sense, and yet it is being done just for the simple fear to drive into communities of you could be sent there. And I think folks additionally are starting to become more aware of this issue as we've seen white representatives and legislators starting to get detained by ICE, which is unfortunate that it, more attention has been brought to this sooner. But I think we're definitely seeing a lot of outrage, but that does stoke a lot of fear. So I think it is very important to center ourselves and look to our community and how to take care of each other. Are there any additional ways to take care of our communities, our loved ones, or even yourselves, Anna or Kathy, that you haven't yet discussed that you would like to share with our audience?
I think in a time where we're feeling so much turmoil, like I mentioned earlier, it's really important. We have to take precaution of what's happening. And of course, reality is reality. People are getting deported. People are getting their human rights violated. It's in these times, it's really important to be able to provide a safe space for people to be able to come together and know that they are not alone. And Kathy said it very well. If you are here, if you have an opportunity to support organizations that are doing something out in the community or out in Washington, advocating for the rights of our people, please make sure to support us any way that you can. And that includes volunteering, supporting financially, because that has been another area where many organizations have been impacted. We know that the executive orders, terminated a lot of grant funding for organizations that are helping vulnerable communities.
Thank you, Anna. Kathy, was there anything else you'd like to add?
Yeah, and I think you touched on a lot of really important areas. Yeah, I mean, like you mentioned, donating to your local abortion funds is really helpful. Right now, we are slammed, as you can imagine. Everybody, at least from Texas, like there are no clinics in Texas. Abortion is completely illegal. So everybody who calls your helpline is having to travel out. So donating to your local abortion fund, even in your states, is very, very helpful. Um, like I mentioned earlier, like be that resource for your community. I think it's really helpful that someone has that people have someone to lean on, and also at your capacity, right? You can definitely it's important to stay informed and get involved, but also take deep breaths, sleep, go out, be with your family. You know, I think that's also really important and a huge part of this work is community. So I think, yeah, those are ways that you can uh, collect yourself and also get involved.
Great, thank you. And how can folks get in touch with your organizations if they are looking for support or questions after this webinar?
Yeah, I can go first. Frontera Fund, we are Frontera Fund RGV on all social media platforms. We post a lot of updates, events, the cross movement work. If you are in the Rio Grande Valley, we will be opening up applications for another volunteer street team cohort. So those are ways to get involved. And if someone who lives within 100 miles of the US-Mexico border from Bronzo to El Paso, and you or a friend needs an abortion and you live in these areas, you can contact Frontera Fund. Our helpline's 956-887-0706. And also, you can always donate to Frontera Fund. Anything donated does go to funding abortion and travel for abortion care.
And if you would like to know more about Alianza Nacional de Campesinas, you can visit our website, which is alianzanacionaldecampesinas.org, and find out about the different membership organizations that we have. And you can also learn about our 4 priority areas that are focused on the farm worker women.
Wonderful. Thank you both so much. It seems we've gone through all of our questions. We don't have any additional. So I wanted to open it up to any final thoughts that you would like to share with our audience if we haven't covered anything that you would like to. I'll pass it to you first, Anna.
I would like to say thank you so much, Reproaction, for bringing up these very important conversations. It's something that is reality, and many times we don't want to bring them up. We, for whatever reason, we don't bring them up in the forefront of what's happening in our nation. And it's something that's very important. While we do this, we need to always maintain that solidarity with our communities and always take a message that we've been here before. We've gone through struggles like the ones that we're going through now. This isn't the first time, so let's be that beacon of hope and make sure that our communities know that we're going to come out of this. And when we do, we're going to come out much stronger. But it takes all of us. It takes us to talk about these topics that nobody wants to talk about. It takes people to support us when we're doing this work. It takes these type of platforms to talk about and share what we're learning from our different communities.
Great, thank you so much. Kathy, any additional thoughts or resources you would like to share with our folks?
Yeah, also thank you all so much for holding this conversation. I think it's really important. It's also really important, like it means a lot to me to be able to talk about the valley and what it is like what it's like living in our beautiful, vibrant community. I love the valley so much and all of the people here, and it's very frustrating that we go through so much. But that's also why our organizing is so is foundationally built on community and working with one another. All of our work is inherently cross movement because of the so many lived experiences that we have. And I think it's important to apply that element to these conversations. So thank you all for holding that. Thank you to everyone who joined the webinar. I love that there are people that are interested in learning more about this. And yeah, that's all I can really say. That's all that comes to mind at this moment. But there's many, many, many thanks to the attendees and to Reproaction for putting this together.
Absolutely. And thank you both so much to Anna and Kathy for coming and sharing your expertise, taking the time out to speak with us. And thank you so much for the work that you both do. It's so incredibly important. And thank you to Jacqueline for putting this together and sharing your knowledge and lived experience as well. Thank you all for attending. I hope you have a great rest of your day. Take care, everybody. Bye.